Hi again, everybody, and welcome to another edition of Around the Town with Chuck. My name is Chuck Guglielmo, a weekly interview show where we talk with interesting people around the community. And today we are taping the show on Thursday, February 21st. And my guests today are from Signature Health. We have Paul Brickman, and we have Mihaela Buter.
Yes.
I did it.
Yes. Very well.
Mihaela is the office director at Signature Health, and Paul Brickman is the marketing director at Signature Health. First of all, tell us, before we ask you your specific roles and duties in those areas, just tell us about what is Signature Health.
Sure. We started Signature Health back in 1993. There was three of us. There was Jonathan Lee, who was our CEO and president, and it was Ann Mason, who was our chief operating officer, and me. And we started out with three people in a little office in Cleveland.
Mm-hmm.
And we moved then to Euclid, and then we moved over to Eastlake. And primarily at the beginning, we were doing work in schools, doing what we call student assistance program work. And we found that to be very fulfilling, but we also began to discover that these kids had parents who were having problems. And so we started to expand into treating adults. And then as we worked, we began to understand too that a lot of these folks had some behavioral health issues, some family history stuff and things like that. And so we started to expand into the behavioral health field. And then we began to grow more and more. And we had an office in Willoughby, and then there was a gentleman by the name of Rich Bondi who was a principal in Chardon that we did work for. He came out to Ashtabula. He was the principal at Ashtabula High School. And one day he called us and said, hey, Paul, hey, John, we need you out here. So that's how we started out in Ashtabula. We started working out here, and there was a need, and we started to go further and further with that. And eventually, we had several different office locations. Now we're located in, the old Ashtabula Hotel, which is just a wonderful site. And Mihaela's doing a great job with that. And the other thing I want to tell you is that about 2 years ago, we became what's called a federally qualified health center, which means now that we are treating people not only for their behavioral health and substance abuse issues, but we're treating them for their physical issues that may be going on, which means now we have a lab, we have doctors, we have nurses, we draw blood, we do everything that needs to be done. And so there's a mind-body connection, we realize that. Mm-hmm. And a lot of the folks that we see when they come in, they don't have a primary care doctor. So now we have the ability to do that, which is really puts us in a unique position.
Exactly.
And
About 26 years, so she said 1993.
26 years, there was three of us, and now we have 700 plus.
Expansion is good for something like this.
We took over a rather large agency in Cuyahoga County called Connections, and so those folks are on board with us now. And they have a residential facility called Orca House, which is in Cleveland. With that, we took that on. And then we've expanded with Bridgeview Manor and Paul's House with some residential facilities too. So.
Mm-hmm. Now you mentioned behavior health as one of the things. Can you give us some examples of what that might be?
Yeah, I'll talk a little bit about that. So we have at the Ashtabula location and some of the services here in Conneaut, we have individual counseling for all age groups. We have where a person comes in, there's usually about an hour appointments, one-on-one with a counselor, a therapist, discuss what's going on. We have, in Ashtabula, we have a team of 13 prescribers, physician assistants, nurse practitioners, psychiatrists, who see patients and treat their mental illness with medications. We also have a team that is dedicated to patients who have dual diagnosis issues, so mental health and chemical dependency issues, whatever those may be, anything from alcohol to heroin. The child team treats children. We had children come in as young as 3 years old for an evaluation.
Oh, wow.
And
That's
then
really young.
adolescents. We offer groups for specific groups. One of the newer groups that we have is for people who have repetitive behavior such as hair pulling, nail biting. We offer that. We have case management services as part of that behavioral component. And the case managers are more out in the community connecting people with resources. They are walking yellow page pretty much. They know the resources, they know where all the food pantries are, they know how to get housing, they know how to report to our prescribers and therapists when somebody's starting to slide down and their symptoms may be getting worse. And sometimes when you're the patient, you can't tell, but somebody who's from the outside notices that there's been a change, and they collaborate with the rest of the team to treat the patient. So that's pretty much behavioral health in a nutshell, and that's what we've been known for the most. In the Conneaut office here, we offer counseling for child and adolescent, adult, and dual diagnosis patients. And then we have every other Wednesday a physician assistant coming out here to prescribe medications to our Conneaut folks and eliminate that barrier of having to find transportation.
We get quite a few referrals out here from the court and police department. And the other thing I wanted to mention about our site too, we do substance abuse treatment, which is really kind of a big deal. There's so many folks out there that through, in some cases, no fault of their own, became addicted. Whether it was prescribed medication for pain or anxiety, whatever it may be. And so we offer substance abuse treatment, and we've been considered one of the premier programs in the state of Ohio. The other thing that I wanted to mention too is that each of our sites, main sites like the Ashtabula office in Main Avenue, has a pharmacy, which means now you can go there, you can see your doctor, and if you need a medication, let's say you see your primary doctor, you need Z-Pak or whatever, you can go down and get it. You don't have to go anywhere else, and it's called a closed pharmacy, which means it's only for our clients and also for our staff. But it just is another instance where at least we know people are getting their medication, where before we would give a script and they would go out the door and we wouldn't know if they took it or if they got it even. Mm-hmm. So we can really try to work to help people who may have an obstacle in getting and taking that medication. So the other, were you going to?
Well, I wanted to mention we have some of our groups are really intensive on the behavioral health side. We have groups that meet 3 days a week for 3 hours, every group, and it's on the behavioral health, it's mostly to prevent hospitalization or link people to a lower level of care. If they have been in the hospital, you're not discharged home to the same environment with a change in medication, but need some additional coping skills. So we have those intense groups, and something that we have to eliminate the barrier. What do you do if you have one child or 3 children and you need to come to counseling for a long group, such as 3 hours? So we have what we call a kid zone, where our patients only can bring their children. They're being monitored by someone. They do activities. They're safe. They don't need to find a babysitter, and they can come to treatment.
Mm-hmm. What are the demographics, like ages, that you see mostly in the behavioral health issues?
We see all ages. We see adults are the heavier weight of our population, but we treat all ages. I believe Paul is pulling up some statistics.
Well, actually, the largest group is between 25 and 50 right now, but we know those demographics are changing as the population moves along too. But you know, the nice part, like, you know, is that we can treat kids that early on intervene on some of the issues that they may have. Two other things, if I may. One is that we have quite a few of our staff that have been trained in EMDR, which is a type of therapy that's used for people that have been traumatized. And a lot of times when we talk about trauma, we think of somebody returning back from the service, but this is also trauma that people experience in their everyday life. They may have grown up in a family where there's excessive violence, and they may have been a victim of it, or at least have witnessed it, and the effects are, you know, you maintain it as a child, you get through it, but then it affects you as an adult in relationships and commitment to jobs and those kinds of things. And EMDR is a specific kind of treatment that's tailored to that, and it's based on some rather intensive research that's been done over the years. It's been proven to be effective, and it's got a lot. It involves rapid eye movement and the connection between the eyes and that kind of movement in the brain. And I know enough about it to be dangerous, but I read the research, and we've got people that are trained, that are knowledgeable, and we've seen the effects from people that are 70 years old, and we've seen the effects with young people, 10, 12 years old, where they can go through that trauma, release it, and they don't keep reliving it. They don't keep getting triggered over and over again. And it opens up a life to them that they didn't know existed. The other thing I wanted to mention too is at Mila's site is we have a child advocacy center. And that came to us with Tanya Burnett, who's the executive director over Children's Services, when we were first getting ready to move into Ashtabula and we were designing the building. I had a conversation with her, and she said, "Paul, can you guys put in a child advocacy center?" And I said, "Sure, what is it?" And here what we discovered was that kids that have been sexually abused and traumatized through that often had to be transported down to the Youngstown, Akron area to be interviewed and to be examined. And what it meant was that kids had to tell their story 3 or 4 times to a police officer, then to a nurse, then to a doctor, you know. And, you know, these young people, it's like, wait a minute, you know, enough's enough. And so we made a commitment to do that. And what it means now is that we get referrals through Children's Services or local police departments, Conneaut, whatever, where they're working on a particular case. And we have a state-of-the-art center set up so we can do forensic interviews where we can interview these children. While the interview is going on, there's a separate room where the prosecutor and those people that need to be in that room can witness what's going on, can hear it and see what this child is saying. We have trained specialists that do the interviews. And when the police department leaves, they've got a DVD that's burnt, you know, and they've got that on record. And we're now moving into the next step. Why don't you tell us?
So in order to be a fully functioning child advocacy center, and we've been open with that for 3 years, and every year we've seen over 100 children a year who have been, or there's been allegation of sexual abuse or have been sexually abused. And
that's just, excuse me, that's just here in Ashtabula County,
yes,
right?
all from Ashtabula County. And these are all children and families who would have had to go to Youngstown for an interview. So it's bringing it closer to home, again, eliminating some of those barriers of transportation. And we are moving into the next phase of having the physical examinations too. And it's not so much to look for something, because there might not be something there, but to confirm with a child that there's nothing that can be seen of what has happened to them, that they're not going to be grown up, so they don't live with that fear that somebody can tell what happened to me, and to just make sure that the child is okay. And there's if there's evidence, we collect evidence. So we just hired a nurse. Actually, she accepted the position to go through the training to be a pediatric sexual assault nurse examiner, and we'll be able to offer that as well. So every child
So we
coming.
It's
continue
really a
to
neat-
expand, which is great.
Yes.
It's really a neat, I shouldn't say neat setup, but you know, I mean, we have this camera that's unbelievable. Unfortunately, you have to take close pictures, and that information is going to be sent down to a doctor in Akron, who will review all of these. That's his area of specialty, and be able to confirm what the nurse up here is seeing, which is unbelievable. I know our prosecutor Nick Rochi, he just loves this idea that things can happen, and it really creates that when there needs to be charges filed, he knows that when he's filing those charges, he's got the collateral he needs to make it happen and clean up some of this stuff. The other part is that then the child and the family may need to get some psychiatric work. Need to see a counselor. We have some counselors that specialize in sexual abuse cases, and so they can get that help that they need too. And this is exciting,
And the
So
way,
Signature Health really links to other parts too.
yes. The way the Child Advocacy Center is set up, it has its own private waiting room, so as soon as somebody walks in, we're notified. We go get them from the main lobby, so there's less stress. We have toys, we have friendly staff to interact with. Families can wait there while the child is being interviewed. It's really non-threatening, and then we've worked with, we didn't work, we were the beneficiaries of a wonderful, one of the churches in Jefferson has made blankets and has donated them to us, so every child leaves with a blanket, just something to
it's really
it's quite amazing, and that we've been able to serve so many people, and that it is such a big problem that one child is too many when
Right.
it comes to abuse, but to have 100 children a year who comes through with allegation of sexual abuse, it is very it's just
Alarming.
unsettling.
Yeah.
Yes.
it's hard to deal with.
Oh, I can
There's
imagine.
a part of me that says, let's go. We're all going behind the shed on this one. I mean, but I
Don't
have
say
to.
it.
I,
We're on
I-
TV.
I have to cool down. Being a parent. It's like, but you know what? There's people that need help with that, and at least now the interventions can happen, and we have a child advocate there too. So
Yes, we have somebody who, we were fortunate to be able to have some child advocacy center coordinator who has great experience with children's services and who is an interviewer, the nurse and the child advocate. So we'll connect them to other services. It is very traumatizing for parents to hear that something even may have happened to the child. So then if there's services needed to help them process that information, we can link them to our services.
and that person also will help them go through whatever legal actions that are going on. Be there when they go to court. Let them know what's happening, because sometimes when things like this happen, the victim is sitting going, what's going on here?
Mhm.
And this way, we have a person who will be able to say, here's what you can expect, and be there to support them throughout the whole process. So it's really something that Ashtabula should be proud of, because not every community has one has a child advocacy
Absolutely.
center. Yeah,
Absolutely.
yeah.
Mihaela, you are an office director. Take me through a typical day as far as what your roles and duties contain.
There is no typical day. Every day is different, but I oversee the operations, anything that has to do with the functioning of the place. There is no typical day in behavioral health. It's whatever happens gets
yeah.
what we just reprioritize throughout the day. So that would be my typical day, setting a different priority as we go and adapting really fast to what the needs are. But I go to out in the community and try to educate people about our services. I keep track of appointments, of things just working well.
Now, when you say you go out into the community, where do you go?
this morning on Sunrise with Jim, today, participating in some meetings where we might be able to have some input of services that are
Courts.
not offered anywhere else. We work with the courts,
Schools,
the school systems.
Paul, you had mentioned that earlier, that we really started off Signature Health being in the schools,
Right.
but not as much now.
Not as much now because unfortunately, there's a lack of funding. You know, and it's hard for even schools to free up teachers to go to training nowadays. Back in the day, I hate to say it, you know, teachers would come for a full week of training. Well, that's unheard of now because there's so much pressure with grades and testing and all those kinds of things. So some of this stuff happens in schools, but most of the time we get calls from schools, or they will talk to parents and they will reach out to us for a referral to do those kinds of things. So. But I think Mihaly's shortchanging herself. I mean, she's got
I
a
think
lot.
she is, too.
She's got a lot on her plate. I mean, it's the day-to-day operation of 100 and some folks
I
that
can
are working
imagine.
out there. People coming in and out, and there's always issues that are going on, things that are happening.
That,
You know?
that sums it up. Prioritizing, reprioritizing,
Yeah.
and just
Yeah.
moving things throughout the day.
And you
Do you
never know
have
what
someone
one phone
helping
call.
you, or
We
as far
have-
as prioritizing what
Um,
comes ahead of this?
We also have a clinical director. Melissa Fields is our clinical director. So we divide and conquer. It's not necessarily, in the past when we didn't have this role, it was all on the site director to complete this role. But we have amazing staff. We just have amazing staff. It's easy. I don't really like talking about my accomplishments or.
Well, then we'll have Paul talk about his accomplishments as a marketing director.
Now, I'll tell you, one of the fun things, seriously, we do in Ashtabula is, I think we've done it 5 or 6 years now, called Trunk or Treat, where it's.
Oh, yeah, I've heard that. They do that here at the library, too.
Yeah, but we do it on a big scale, and it was just a harebrained idea that John and I had, and last year we had about 25 or 30 cars, and I get a big tent, and we do kids programs. We get, we got clowns doing balloons, and last year we had almost between 3,500 and 4,000 people show up.
It is just
It is
most
remarkable.
exciting, amazing thing, and things work so well. We've never had any kind of incidents when we've had so
Yeah.
many people there. It is just amazing, and to see the smiles on the children's faces. We had a cotton candy machine, so
Oh, yeah.
we give out cotton candy that we make. It is just amazing,
We buy all the candy.
right?
And-
Which is a
and the-
huge plus.
And the people that are there distributing the candy are all employees or people who we personally know. They decorate their trunks, and so we keep funneling the candy out. And
What a service.
oh,
And sometimes we have a hard time keeping
these guys
the
away.
runners. Yes.
no, keeping these guys away from. But I'll tell you, Jim Timonere, the city manager, is so cooperative. He shuts down Main Avenue, and we have got the radio station that comes out. And my mind just went blank. Which station is it?
WKYC.
No.
The Ashtabula Media One.
98 point something. The
Oh,
Bowl.
the Bowl.
Yeah.
Yes.
Yeah, we do
Sorry,
promos
guys.
with them. They have a couple people there that day, and I'll tell you what, we've been blessed every Friday that we've done it. It's been nice weather,
Mm-hmm.
you know, because you're rolling the dice, you know. And last year when we did it, it was beautiful, and when we were just done, it started to rain.
Oh,
And it was
so
like the next 4 Fridays after that, it was just horrible.
somebody was looking out for you.
Really.
Yes.
But it's something we really, and I hire 4 police officers just to be there. And, last year they had bags, they're giving candy out. Fire department's there with their fire trucks for kids to see, and they're giving candy out. So it is such a fun thing. And every year the police officers go, they just can't believe, they go, this is such a family-friendly thing. And so that's one of the things we're really proud of. And then we do the Christmas parade.
Yeah. And if I may talk about Paul's
Absolutely.
accomplishments, we
Oh, is he
are.
cutting himself short,
Yes,
too?
yes.
Yeah,
I
okay.
can talk about his, not so much about mine. I don't like talking about myself, but with Paul's work and Jonathan's, we are in 3 counties. We're in Ashtabula, Lake, and Cuyahoga counties. We have offices in all these counties, so it really is tremendous growth and accomplishment to bring services to underserved areas, because where we are right now on West 25th in Cleveland, it is an underserved area with a lot of people coming in. We're on in Beechwood, we're in Maple Heights, we're in Willoughby, we're in Painesville. So all these areas are, all the services we offer in Ashtabula are also offered at the other locations. So that is
Well, and part of that is our planning. You know, we, in order to keep doing what we're doing, you have to grow. Because when you have those folks that, the Medicaid folks, the Medicaid HMOs, I don't want to get into it, but you know, they look for agencies that have a large footprint and provide a whole array of services for their people. And so we have positioned ourselves for the future to be able to do that, and which is something that we work hard, because you know, it's a scary thought when you think, you know, we got 700 employees, you know, and they're making house payments. They're putting their kids in school. They're putting food on their table, you know, and we got to make sure that it keeps happening.
And part of that, Paul had mentioned that we're a federally qualified health center, which what it means is that we get different reimbursement and have some different benefits with federal funding to expand services to people who don't have any insurance or underinsured. We have a good sliding fee scale, so we work on payment plans with people, and that is one of the huge accomplishments. Being a federally qualified health center allowed us to bring in primary care, free vaccinations. I was mentioning this morning also, we have all the vaccines for adults, and in April we're going to be able to offer free vaccines to children who don't have insurance or are underinsured, or their insurance that they carry, their commercial insurance, does not cover some of these vaccines, so we are able to offer those. It's really a huge accomplishment, and we had growing pains because we've grown so much. An accomplishment, we became a federally qualified health center and merged with Connections all in 1 year, doubled the number of staff, and had to report to the government our progress and what we're doing. So being endorsed by
the FQHC thing is really big, because the year that we were granted that status, we were one of 14 in the United States and one of 6 who were new applicants. The other ones had applied before. So it was just, we were really proud that we had done the work that was necessary for the federal government to say, okay, you got a stamp of approval. And Federally Qualified Health Centers have been in existence for over 50 years, and they were primarily designed for folks that were in underserved areas that their net medical needs were not being met. And so, believe it or not, there was an area in Painesville, an area here in Ashtabula that fit the qualifications for that. And so what it means is that all the folks in Ashtabula will reap the benefits of us being able to provide those services. And so.
And going back to the behavioral health, patients who are seen for behavioral health who have severe mental illness are less likely to go to a doctor's appointment for their primary care, for physical, for diabetes, for hypertension, because it's scary. It is scary, it's unknown, and don't know where, can't make a phone call when the voices, with somebody with schizophrenia are you hear that you can't focus on, you can't keep the schedule to go to appointments. So now we have it all under one roof. So if we have somebody coming in and it's identified that they need a physician to take care of their physical health, they can walk them down and get an appointment to be seen. They can have their lab work done right there on site. If they need an EKG, they have it done right there on site. If they need medications, as Paul was saying earlier, they can pick them up right that day at the pharmacy without having to find rides to all different places and people to help them get there, or people advocating for them. Or
Now, how you guys are saying how you connect to other organizations. I know coming up in the first weekend of April, they're having this RAM clinic, the Ashtabula Town Square, where like you were talking about the insured and the uninsured and free screenings and stuff. Are you associated with that at all?
last year we had a table and we're planning with resources. We're planning on having one this year. We had many of our staff who volunteered to work at the RAM clinic, and then Paul, generous marketing director, donated the money to provide lunch on, during the RAM clinic.
I did.
You did, yes, you did. I was told
There'll
you
be
did.
bologna sandwich.
Will you do it again?
So, and you know, the other thing is we're excited to be out here in Conneaut too.
And you've been in Conneaut how long now?
Middle of 2017
And located where in Conneaut?
at the Conneaut Human Resource Center.
Yeah, and you know, we're gradually going to be expanding services out here. You know, one of the things, you know,
We are?
you know, you have to have a business model, and you can't just put everything in what you need right away. It takes a while to build a referral basis, and so Gail Castrilla has been doing a wonderful job out here, connecting with the community since she's been out here her whole life, I think, hasn't she?
Oh, yes, this is home.
So you're in Ashtabula, now in Conneaut. Anything in Geneva yet, or?
As of now, we don't have plans to go into
So just
Geneva.
Ashtabula and
Right.
Conneaut here in the county?
Yes.
And then like you mentioned, Paynesville and Willoughby? In
Willoughby?
Lake County?
Yes.
Yeah, it's,
What services are only offered in Ashtabula?
well, Child Advocacy Center is only offered here. But
We have services that are offered some days of the week here in Ashtabula. So we have an infectious disease doctor who comes every other Monday to Ashtabula. That I think sets us apart and unique because we have many people who come in with hepatitis C, HIV related illnesses, hepatitis B, sexually transmitted diseases. So we are able to have a doctor who is a specialist in this area to provide care, and it's really easy to access it. There's a direct line. I have the number if I may share it.
Absolutely.
It's 440-853-9740, and that goes directly to the infectious disease team. If somebody has questions about appointments or how to get in touch or how to get a test to see if they do have something, there's a lot of transmissions through dirty needles that people may not know that they have it, but we're grateful to have it. And then we also have the Ryan White program, which is a federal grant for treating people with HIV, and they can have under this grant counseling. They can have medical transportation to appointments. A lot of their appointments are in Cleveland for specialists. Case management. We also have a group that is specific to the area. And one initiative that is particular to Ashtabula is we have a couple support groups that are originated by people who have received services in Ashtabula. One is for people with eating disorders. There's a support group for that, and they meet on Fridays. And then we have a support group for people who are in medication-assisted treatment. That group meets on Tuesdays, and that is rather unique to us.
Very good.
and the other message I want to give too is that one of the things that we did was we joined forces with the prevention folks out here to produce a video called We Do Recovery. And I wear this wristband every single day because recovery is so important. And people are recovering. They're in recovery. You know, we often see the side where you think it's hopeless. And we did this video 2 years ago, and we featured 5 people from this community. And 2 years later, they're all still in recovery, and 3 of them now are working in the field. And so I would just encourage you, you can go to our website. We have a whole section of videos, and the top one is We Do Recovery.
And what is the website?
Signaturehealth.com. It's just a remarkable thing. And every year we highlight it and show it again. Last year we did it over at the Ashtabula Library, and we probably had 100.
Kent State.
We did Kent State, Ashtabula Library. We get 150, 200 people show up for it. And it's a real positive kind of a thing. And so that's a message that originated in Ashtabula. And now it's, you know, we send it out throughout the state, and even to some national organizations have picked up on it. And it's very well done. And that's something Ashtabula should be proud of too. So.
And it's very touching because it's people who are in recovery and who have gone through it telling their story. It's one, I cannot tell the story of someone because I haven't been in their shoes, so it's really an amazing.
Two of their mothers are in it too, talking about how they struggled. And
How tough is that for them to do that?
I believe the message that they recover is what gives people, that there's recovery, that gives people strength. I can't imagine how tough it is. And it was, there wasn't a dry eye in the room when we showed the video, and when they first previewed it. But I believe the message that they drive is just so personal and so important that people recover.
And part of recovery is paying for it. You know, to seeing other addicts out there, there's hope. You know, look at me, I made it. That kind of a thing.
Yeah.
You know, so when you're down in the dumps, you know, you think, you know what, there's a hand there for me. And that's what these people are offering. And that's part of their recovery in order to pass that message on.
And you will hear on that video that people, it wasn't a one try and I'm good. It was one try, not this time.
Back to jail.
Yes, another try, no, not this time. So really the message of not giving up and that you can recover is important. And
that's why we say we do recovery.
Absolutely. Now, I see you brought some pamphlets here. What's all in the pamphlet?
This one is about the Conneaut office, which was our hours in Conneaut and what services we offer in Conneaut.
Okay.
Yeah, we have many more. We have Paul is of course our connection to the printer, and comes to the office with stacks and stacks of boxes. Here you go. I got you this flyer.
Yeah. But we continually are spreading the word. And a lot of times organizations or schools will say they're having an open house, they're having a parent night, can you come over? And, you know, so we always try to have somebody there to give out some literature, talk with parents, you know, give out our, you know, I always give out my cell phone number to people, you know, and sometimes you get that call saying, I remember, you know, it's like, thank you, God, we're doing it.
Yes, absolutely. You guys are doing a great job. The website again is signaturehealth.com. And what was that phone number again?
For our phone number for the services, and they can also link to infectious diseases, 440-992-8552, and then for the specific one for the infectious disease team is 440-853-9740.
And office hours?
We're open Monday through Friday, which is a great part of my job, not no weekends. I can highlight that. I will. Monday through Friday, we're open 8 a.m. to 8 p.m. on Monday through Thursday, and Friday we close at 5.
We try to make it convenient, you know, if people are working and that. So.
Well, you guys are doing great work. 26 years strong.
Yeah.
And keep up the good work.
I was only 7 when we started this, so. But thank you, we appreciate the.
Well, I appreciate you coming in and getting your message out there, and hopefully our viewers will, if they need to take advantage of it, that they do.
Thank you for
you
having
need help
us.
now?
Now, I need to make sure I got these names right again. Mihaila Butek
Yes.
and Paul Brickman.
That's an easy one.
My guest today on Around the Town with Chuck.